left. So right there. Perfect. Got it. Sweet.
I have an online business, so I always sit home and then work on my phone. So I do that almost like more than half a day. So just like sitting on a chair or on a couch, probably that made my pain worse. And I mean, as soon as I found this, like I'm having a hard time on my shoulder and the hip, I always wanted to get better and then start working out, because I used to work out a lot before, and after this business I just like had to quit everything and then just sit on the phone all the time. And yeah, I did a lot of research to find this place.
What's up, everybody? It's Dr. Brett Jones here at the Source Chiropractic, and today we're joined by Sudhakar, who's here all the way from Ontario, Canada.
Yes. Yeah.
Now, he's been on a mission to heal for quite some time. Growing up as a child, he experienced some low back pain, and in like the last 3 to 4 years, you really had a condition that's kind of taken over, right?
Yes.
And it's the pain that you experience at the top of the clavicle,
yes,
goes into the neck, into the base of the skull, correct?
Yes.
And that has made the hip and low back worse.
Worse, yes.
And you've been on a mission to try to figure out how to heal this, right? I heard you gone like all over Canada, went to Denver, Colorado, and
yes,
now you're here.
Yes, yeah. I've been to so many places just to like be better and be actually how God gave my body.
Right.
Yeah. So I've been to Canada, all over Canada, like everywhere in Vancouver, Alberta, like Manitoba and Toronto, Windsor, like so many chiropractors, like probably 20 chiropractors, maybe like 200 visits. And finally I thought of going to Denver and see someone there. I've been there. I mean, he did pretty good, and I feel better than before after he did. But it went back again, how I was. And so finally I was like still doing my research online, and finally I found the Source Chiropractic, and then I just called them and like booked an appointment to come here and be better.
Beautiful.
Yeah.
And so he's here for a week-long healing immersion. I believe we're on visit 11 today, and we're going to show you a little bit what we found in our assessment. And I do want to make a point here that, you know, healing is a process. And so our goal here is to get that process going in the right direction. And we've had communication together that there are going to be things that we need to do at home and on our own that are going to continue that healing process. But hopefully we can provide him some relief and give him some insight so he can continue the hope in healing.
Yes.
All right, you ready to rock?
Yeah.
All right, go ahead and go face down, brother.
Thank you.
So when evaluating Sudhakar's gait, what we're finding is that he has an elevated left shoulder, and it's actually a superior lateral stuck clavicle. And we are seeing dysfunction in the left SI joint. I had him lift his leg up and turn out to the left. He couldn't go as far. He does feel stuck in the actual femur, where the femur connects to the acetabulum, but also has pinpoint SI joint pain. We checked the muscles. We did a full comprehensive initial assessment. He scored low in both the quad strength and psoas strength. And upon palpation, discovered that he has a really tight iliacus and psoas, which can create a certain listing on an ilium, but we're going to check it right here and right now on the table. So upon tractioning of the heels, he definitely has more tightness or tautness on the left Achilles tendon, and we don't get as far of a traction on the left side. And I'm also going to read again the entire system when tractioning the heels. How far does the tissue allow this extra stretch to continue throughout the system? And he gets really locked up on the left side, and he gets locked up mainly at the SI joint, so we do have an SI joint issue. As we bring the legs up, we're going to notice if you have pain there. Yeah. So he experiences pain, because what this does is it causes flexion. See the jump that's happening? It causes flexion at the lumbars. So let's see what happens if we go leg out. So his pelvic motion starts right away, even on the right side. Left side even faster. that can be an indication of an IN ilium, so an internally rotated ilium. We're going to palpate the entire spine. So he's got some tenderness, and really, what I'm finding right now is that it's the L4, L5 that has a lot of facet compression, which then can radiate into the sacral area or the iliac area. So I'm connecting to an ASIN ilium on the left side. So it's an anterior rotated internal pelvis, which then also has L4, L5 dysfunction. And so we want to know what's the primary. And so one of the ways we can help discover what the primary is if I rock the ilium into a better position, you can relax, but take a breath. Let it out. If I rock the pelvis into a better position, does the L4, L5 start to relax? Not really, we're staying tight. So I believe the L4, L5 is the primary and this is secondary. Palpating the cervicals, we have a flattened cervical lordosis, which will cause us more tension in the neck and upper back in general anyway. We're gonna go ahead and start with L4, L5. So go this side up for me. Face me this way. So we are always deeply appreciative and honored by the people that travel to come see us and try to create as a comprehensive of the program as we can for the people to see results. Okay, so now here we can check the different vectors of what's going to allow this system to experience the most ease. You got a cramp? Breathe. Let it go. There we go. Perfect. So as I torque my hand this way, this is where the spine starts to open up. So we're right there. Roll. Take a breath. Let it out. Face down for me, brother. All right, there's our start. So there's a potential that if we clear the L4, L5, that as we bring the legs back up, so we're not getting the facet compression there, that's better, right? Yeah. So you see when we first started, his system was jumping as we brought the legs up. Now he's allowed to go into that slight lumbar flexion without getting the muscle spasm and or pain. So we're much better there. Let's check the motion again of the pelvis as we bring the legs to the outside. We're about right there, it starts to stick. Right there, but not as much pain going to the outside now, huh? That's better. So again, I think the L4, L5 is actually the primary here, which is causing the pain that he's experiencing in the SI joint. We're getting better movement on the L4, L5, less muscle spasm. And recheck the tension on the heels. Tension on the heels is much improved. So for me, right now in this moment, that is good for the low back. Let's go ahead and roll you over to your back. One of the muscles he had a weakness on was the left psoas and the left quad. So we're gonna start with the left straight leg quad test. Push up to the ceiling, push up, boom. That's full 5 out of 5 muscle strength and coordination. We're gonna bring the leg out here and you're gonna push up in this direction. This is testing the psoas, push up. Good, that's better. So actually I pre-tested him before we did the adjustment. Now it's firing full 5 out of 5. It was a 4 out of 5 pre-adjustment. And then one of the things I was picking up was a superior lateral clavicle, which is causing fullness in the left side and elevated shoulder on the left side. We've worked a lot with him. We've done some TMJ work. I adjusted the anterior C3. I know Dr. Jordan has worked on his occiput. So, we have a variety of chiropractors providing a variety of care here, but you're tender here at the top, huh? Mm-hmm. Okay, so I'm actually gonna get you to take this off for this moment while we do this other adjustment. So this is, you feel it here too?
From here.
Yeah.
And here, like 1, 2, 3.
Yeah.
And 4.
Okay. So he's got multiple tender points along the rib cage and along the clavicle, the AC joint. Go ahead and sit up for me and face that way. Take a breath. Let it out. So first rib moves good. Take a breath. Let it out. Yeah, it's a lateral clavicle. So on the lateral component, where it starts to enter into the acromion, it's right there. And he can do something when he retracts his shoulders. He creates a clicking on the left side. So go ahead and do that. Right there. But when I put pressure on the clavicle to the outside, relax for a second. And go ahead and do it again. It gets a lot better. So that's the positioning, and that's where we want to go. So I'm going to roll the clavicle inferior, medial.
Let me know when to inhale and stuff.
Yeah. Let your head laterally bend to the left. So right there. Perfect. Got it. Sweet. Roll to your back again. I'm gonna double check that. On your back. So that was a lateral to medial, superior to inferior roll on the distal clavicle on the left side. And we got pretty good movement there. Rechecking the legs. I know you can experience pain with internal chest. Not bad, huh? Good here. Outside. That's good. Sweet. We're doing better so far. We do a spray on my hand real quick. Okay. Okay, so now that we've gotten the movement on the clavicle, just seeing if there's anything left there. So this clavicular space is a lot better. Now I'm actually really picking up the C7 that's anterior. Take a breath in, let it out. So when the clavicle is superior and lateral, all this myofascia, the fascia and the muscles here was really taut, and I couldn't feel the C7. But as we've unwound and put the clavicle in a better position, I can really connect to the C7 that's anterior. So we're gonna go down this way through the front side of the joint. So it's here, right there. Relax the head. Perfect. Breathe. Let it out. Good. Gonna go ahead and, how we doing?
Yeah, doing good.
That adjustment, you can have a huge endorphin release. So people can often feel lightheaded from that adjustment. It's right in the supraclavicular space where we have a lot of blood vessels, so it alters the flow of the blood and the oxygen that can hit the brain. Okay. So really good, bud. Checking C1, C2 at the top. Okay, we're gonna adjust C2, posterior to anterior here. Perfect. That's good. I'm gonna check your iliacus again. Okay, do one more check on the psoas, making sure we're still balanced here. Push up. Perfect. All right, let's watch you walk one more time. Come on up. So if you want to start over here, and then you'll walk away. So walk, the walk can help with integration. You're gonna walk away and then come back. All right, so that shoulder's dropping a little bit on the left side. Come on back for me. The left hip is definitely moving better. Beautiful. So you can see the redness here. So if you want us to turn a little bit this way. So that's where we made the adjustment on the C7 and the clavicle. Clavicle's a little more distal, but as you make these adjustments, you can often see redness as the blood now returns to the skin because you're freeing up muscular adhesion. How are we feeling in this moment?
Hip is like totally fine, I feel like.
Yeah.
I still have that.
Some tenderness on the left side.
But hip.
But hip's a lot better.
Never felt hip like this before.
Good.
Yeah.
All right, bring your head back into extension. Good. So with him, he gets a lot of compression at C4, C5, C6, C7.
Going up like
Right, and then it continues up. So continual traction and opening of his cervical spine is going to be really, really good. That was a new adjustment for him. The left shoulder is actually dropping down even more now. So before we had elevation, if you just get a straight on shot, Alex, you see that it's actually starting to depress a little bit. So this is freed up, right? And so now it's just actually training the neurology that it is a different pattern. So what happens is you adjust the body, things are different, and yet, you know, the brain hasn't fully adapted to it yet. And so there's still a memory, right, of the pain cycles that you've been in for a long time, but the actual physiology is better already, and we see it. So, great adjustment. Thanks, brother. And then we got a few more before you take off.
Here they actually look into every single thing and then like figure out what is going wrong, and then they spend some time with you to fix your problems. So I mean, I was really upset that I have to travel many countries. I mean, I've been to Denver, I've been to China, I've been to India just for this treatment, and I've been like different countries. And finally, after I came here, I feel so much difference. I mean, I think like my hip pain is almost gone. I feel like it's been there with me for probably 15 years. It means like a different life, right? I mean, it's definitely a different life. I mean, it's just not stuck in the house, or now I can go to the gym and then work out and be fit. I feel a lot better.
If the Source Chiropractic can be helpful to you, we'd love to see you. We'd love to create a specific care plan for you to help get your needs met and hopefully provide some light on your journey. Till next time, peace.